Hello, and today I'm very pleased to be to reintroduce Marianne Nicholson, who we spoke. Marianne, I think it was a couple of years ago now, and turns out to be one of our most popular YouTube videos. So I thought it was worth a revisit. And Marianne, sorry, is from the Herpes Virus Association and Shingles Support Society. So conditions that are very much in our life, but I actually think there's some ones that we don't talk about for sure. And we all know that there's various things we talk about and things that we don't talk about. And I think herpes, particularly genital herpes, falls neatly into that category. So welcome again, Marianne.
It's lovely to talk to you. And indeed, the stigma is one of the main points about having herpes simplex. On the phone calls, we get people saying, I don't mind having it myself. I just dread passing it on. Now, no one is going to say, I don't mind having cancer myself. I just don't want anyone else to have cancer. You know, it doesn't work like that for anything else, which means that actually it's not the condition that people are worried about. It's the word, it's the name. And when you call it a cold sore, people don't freak out because they know cold sores happen on the face and they're common and granny gets them and so on. But one of the points I make when I'm trying to sort of show people about stigma and the issues is this. I can scratch my head in Sainsbury's. I can scratch my cheek. I can scratch my shoulder. But I'm not going to scratch my crotch or my bum in Sainsbury's, you know? So we just have a stigma about that region, but the virus is very common. People don't realize how incredibly common it is because most people, when they catch it, don't ever notice. Only 1 in 3 is ever going to get symptoms that are bad enough to get a diagnosis, to go along to the doctor. Others will have little symptoms which they identify as, say, an infected hair follicle or a little cut or a little sore patch or a little itchy patch. So they don't take that to the doctor. So they never know that their little itchy patch is actually a herpes simplex infection until much later when they've infected somebody and it all comes out and we have a long discussion all about it.
And that can be very tricky and very difficult, can't it?
It can, because it means that everyone who catches this thinks they're the only one. And then if they go Googling it and they don't find the Herpes Viruses Association website, they'll start finding all sorts of stupid scare stories on it. So my story is that I caught it from a person who didn't know they had it, and that is usual. Usually the person we catch it from does not know that he or she has got it. And I got all the scare story stuff, and I spent 2 years in abject misery, convinced I would never have sex again. Luckily, I had a really interesting job, so, you know, I just carried on working merrily. My career did very well during those 2 years. And also, right at the beginning, I had 15 outbreaks in the first year. It quietened down after that, and I'd like to jump right up to the future now and say, listen, folks, it's been 5 years since it even tried to come out on me now, so there's been a significant change for the better. Anyway, back to 2 years in after I was first diagnosed, I discovered the Herpes Viruses Association, and I got good information from them, and that totally changed my life. So, you know, I was able to move forward. I've had relationships. As far as we know, nobody has caught it from me.
Gosh. And I think being able to, having had the condition yourself, that allows you it allows you to relate to people and to understand exactly what they're going through and what their fears and concerns are.
Yes. All our helpline volunteers are told to say something very short early on in the conversation to just indicate that they have it too. Not a formal statement, just if someone describes really bad symptoms, they could say, oh, poor you, mine wasn't nearly as bad as that. Do you see? Just those few words shows the caller that the person they're talking to actually understands the condition and has been through it themselves. And but our volunteers have all come out the other side, so they can all reassure people that there will be a happy life thereafter. As long as you're not getting too many recurrences. And that can be a nuisance for a very few people. Not many, but we do get calls from people who are having a really bad time with recurrences. Mind you, Katrina, it's important that the person doesn't try and blame everything that happens to them on their genital region on herpes simplex. One of the things that we are very keen to tell people when they're getting a lot of recurrences is that a herpes simplex recurrence will be on one side only. When you think of facial cold sores, no one ever gets matching pair of cold sores. It's always on one side or the other. It can swap sides, but it'll be one-sided at a time. And it's the same down below. So if your problem is itchiness on both sides, it could be thrush. If you've got little spots on both sides, it could be Behçet syndrome. In fact, there are 28 other conditions that a well-informed doctor will be considering when all the person with the herpes simplex is considered is, have I got a recurrence? And of course, the other thing people can do is treat it. And a herpes simplex repeating condition will go away if you are taking the antiviral therapy. The usual dose is 400 milligrams twice a day. We go into the detail of treatment on our website page. And if that does not do anything to your symptoms, well, indeed, check to see if it couldn't be something else. It could well be, just because you have got herpes simplex doesn't mean you can't get eczema down there or lichen sclerosis down there.
So very, very quickly, how do you go to get diagnosed? Would you go to your doctor, or how does it work?
It's usually best to go to a sexual health clinic because they are utterly used to dealing with that region. Some doctors have signed up to do sexual health, which means that they've done a training course. It means that they've got the kit to collect the sample and actually send it off to the laboratory. An ordinary GP will probably not have the collection kit to send off to the laboratory. And therefore, an ordinary GP will probably just make a guess. In fact, it has been found, the researchers have done their research and they have found that masses of GPs, or in America, family doctors, will guess that the problem is probably thrush. They will give the person thrush treatment. Since herpes simplex will go away all by itself, treatment is not necessary. It's an option only. It means that giving the person thrush treatment, well, the symptoms will go away, whether it was herpes simplex or thrush. So often it is found that herpes has been misdiagnosed as thrush at the family doctor level.
Gosh. So on the basis that this is really in addition to the original conversation we had, and we were just looking at one of the things that you wanted to cover again, and perhaps in a little more depth, was the transmission of the virus.
Yes. Transmission. That actually follows on a bit I didn't say when I was talking about diagnosis a second ago, which is that it can only be diagnosed when you have symptoms for them to take a swab from. So they need to see some damage to the skin where they can swab it and send it off. Now, the damage to the skin is full of virus. So clearly, don't have sex when you've got, don't kiss when you have a cold sore. Don't do oral sex when you have a cold sore. When you have a genital sore, don't do sex, and don't allow someone to do oral sex on you. So the other thing to point out is that you might be a little bit infectious, say 24 hours before the outbreak is visible on your skin. Now, for most of us, we get what are called prodromal symptoms. These are nerve sensations to the affected area, which warn you that an outbreak is coming. It could be a tingling, an itching, a stabbing, an aching, a burning, or that volcano feeling under the skin. If you remember teenage spots on your chin, before they came out, you had a sort of volcano feeling on your chin. Well, you can get that before the outbreak develops, wherever it's going to develop. So don't have sex at that time. And again, if we take it back to facial cold sores, you can well imagine that a person with a facial cold sore knows well enough not to kiss when they've got a cold sore. But no one has ever suggested that if they can feel a cold sore is on its way, that they should refrain from doing stuff. And so it gets passed on then. However, you who've learned about it now from this video, you can protect your partners much better by ceasing action the moment you feel those warning tingles. The other thing, people start imagining tingles all the time. Don't do that. The tingle will alert itself to you, or the itch, or whatever it is. So, for instance, right this instant, if you ask your body, can I feel an itch or tingle somewhere? Well, you probably can. I've got one behind my left calf. But that's because I asked my body, do I have a tingle? With the herpes simplex thing, it is telling you, pay attention, it itches here, or pay attention, it stabs here, or something like that. So don't get overly confused by your symptoms. And then wait 24 hours after the outbreak has gone away before you have sex, just to make sure that the everything is calmed down, and to allow your skin to thicken up after the outbreak. Now, on the internet, there's a lot about asymptomatic shedding. This means virus could be on the skin between outbreaks. The more outbreaks you have, the more chance there could be virus on your skin between an outbreak when you don't have any sensations at all. However, this is not in everybody. I think only half the people on the trial did actually have any asymptomatic shedding at all. And also, it goes down very rapidly in the first 6 months. The graph of shedding shoots down the page, and then it carries on going lower and lower till about 2 years. And after that, it's pretty well stuck, but right at the bottom. So the expert doctors of the British Association for Sexual Health and HIV, BASH, have written a guideline for patients, a patient information leaflet. You can find it on bash.org and look for the PIL, the patient information leaflets. They say very clearly that after 2 years, unless you are getting frequent recurrences, and they define that as 6 or more per year, you're allowed to forget about asymptomatic shedding. It's just not a thing. And that, of course, is why people with facial cold sores are never warned about the asymptomatic shedding, because it is assumed they've had their cold sore for longer than 2 years.
I'm very fortunate. I've never had cold sores, so
As
but
far
all
as
I
you
know,
know,
as far as I
you know,
know,
Katrina.
yes, exactly.
Mm.
But yes, but I know exactly what you're saying, because the people that I know that have them, they will say, "Oh gosh, I know I've got a cold sore coming. I can feel it," and people are quite animated about it. They know they've got one coming.
That's good. That is very good. That is very good.
Yeah.
And
So one of the things that we're going to talk about, about people who don't know they're infected or whatever, one of the things was sort of about condoms and how do couples manage long term with it?
condoms are 100% useful in protecting a partner if they cover the place where you get your outbreak. Now, obviously, people can have outbreaks. They can catch it, for instance, below the area covered by the condom. They could catch it on their testicles, their balls. They could catch it on the skin around the penis. And then, of course, for women, the symptoms can be anywhere in the vulva area. And therefore, a condom is not going to protect his belly or whatever from rubbing against that area. However, BASH, the expert doctors I mentioned, say that when a man has got it, using a condom in general overall is 95% protective. Or maybe it's 96%. I must check it. Anyway, extremely protective of their partner catching it. Because you see, nearly all men will get their symptoms on the area of penis that is covered by a condom. And even when a woman has got it, using a condom is 65% protective to the man. So it is a useful thing to use. But no one is ever told that they have to kiss through a sheet of cling film for the rest of their lives. It's people get much more agitated about the risk of passing it on from the genital region than they are from the facial region. If a doctor says to a patient, well, if someone phones me and says that the doctor said, "Oh yes, that means you're going to have to use a condom for the rest of your life," I would like that patient to turn to the doctor and say, "Do you tell people with facial cold sores they have to kiss with a sheet of plastic on their face for the rest of their lives?" It is daft to make this. And then, as we keep saying, only 1 in 3 who catches it knows. So even if those of us who have it genitally use condoms 100% of the time, and ladies, I don't know, put plastic over their area so that, it's even better than a condom, it won't stop the spread, because it's being spread from the people who don't know they have it. In fact, that is a quote not from me, but from one of the world's top herpes doctors, Dr. Lawrence Corey. In a recent publication, he has written, transmission is most often occurs from the people who are not diagnosed, which means that the people who are diagnosed are less likely to be passing it on. So we know we have it, we are less likely to be passing it on. The other thing, while we're dealing with this 65% effective even where the woman has got it, is this fact, ladies. Women are 1/6 as likely to infect men as the other way around. So we are hugely less likely to infect men. Something to do with larger area of skin, delicate skin, that kind of thing it could be. But the other thing, actually, while we're talking about diagnosis and that kind of thing and protecting partners, is people ring up and ask us, Katrina, they say, could I get my new partner blood tested to find out if he already has it? And the answer to that is no. The blood tests that are available commercially in England, all over the world, are going to give you one false positive in 10. Would you buy a pregnancy test that was going to tell you you're pregnant when you weren't, one time in 10? I don't think so. And they're going to give you a false negative, which means the person has it, but they're told by the test that they don't, one time in 3. We know
Oh,
people who've
wow,
had
that's
positive.
dangerous.
We know people who've had positive swab tests, and then they go along and they get a blood test, and it's negative because their antibody levels, which are working perfectly well to protect, they're not having lots of outbreaks, but they have a low level of antibodies, so the test is negative. In America, an organization called the Food and Drug Administration, which is a bit like they're NICE, it issues guidelines for doctors, has written an open letter to all family doctors, all doctors, saying do not use these tests on your patients. It's just not worth it. It's not fair. So, we encourage people not to waste their money on these tests. The only valid test is something called the Western blot. It is done in one place in America, and it costs nearly $300. So scientists will use that test.
Gosh, it's all a bit of a minefield, really, isn't it? Trusting your partner, but even if you trust your partner, they may have it, but they don't know they've had it.
Correct. As I've said, if everyone who is diagnosed never has unprotected sex again, or indeed puts on a chastity belt and never have sex again, as some people very sadly do say when they phone us up, it's not going to stop the spread because most people are going to catch it from somebody who doesn't realize they have it. It's why the stigma is so stupid.
Sorry, I was just going to say, and do we know what the stats are for, is it 1 in 10 people have it, or, what is it?
No, much more than that. By the age of 25, 7 out of 10 people in the UK carry this virus. This is a low figure. In other countries, it will be higher. Now, of course, 6 out of those 10, it's type 1. But since new cases of genital infection these days are nearly always type 1, you can't sort of say, oh, we can dismiss type 1, because no, it is a major cause of genital infection. And then 1 in 10 by the age of 25 is type 2. It goes up. So we've got detailed statistics from Australia where they did a huge survey of many, many people. And they have found that by the age of 35, around 1 in 5, 2 in 10 people has got type 2. And nearly everyone, 85% of women, that's 8.5 out of 10, 77% of men, that's nearly 8 out of 10 men have got type 1, which, as I've said, is often genital. And anyway, even if it's facial, it can give the partner a genital infection through doing oral sex. Now, we imagine... Sorry.
What's the difference between type 1 and type 2?
The doctors say type 1 is habituated to the face and type 2 is habituated to the genitals.
Right.
Let's express that in English as opposed to in medical speak. Type 1 likes the face. When it lands on the face, it will cause lots of recurrences. You can land type 2 on the face by doing oral sex on somebody who's got type 2, but you won't get much in the way of recurrences, if any. It's the opposite down below. Type 2 likes the genitals and will create plenty of outbreaks down below. You could catch type 1 down below, but because it doesn't like that region, you won't get many recurrences.
And then moving on to another area that I know we didn't really discuss last time is around pregnancy. So could you expand a little bit on being pregnant and having herpes?
Since the ladies watching this will mostly already have it, I can reassure you that where you've got the virus before pregnancy begins, there's no problem at all. You can have normal delivery even if you had a recurrence at the time of delivery. If that freaks you out, think about this. Since babies were first invented, women with cold sores have kissed their new babies 24 times a day. And there is no common knowledge that ladies with cold sores kill their babies. The reason why this is fine is that during pregnancy, during the last stages of pregnancy, baby acquires antibodies for all the things you've got antibodies to. So if you had chickenpox as a kid, your baby is born with chickenpox antibodies, herpes simplex antibodies. And if you've had a recent COVID vaccine, COVID antibodies. This is nature's way of making sure that brand new babies don't immediately catch whatever's going round. It doesn't last long. That protective antibody, which is called maternal antibody or transplacental protection, lasts about 3 to 6 months or longer if you breastfeed. So another reason why breastfeeding is best, if you can.
Okay.
Now, women who talk about this with their obstetrician, gynecologist, midwife will be offered antiviral pills from week 32 onwards. But remember that every woman who's got it genitally and talks to her midwife and gets pills, there are 2 others who have it genitally, are totally unaware, do not talk to their midwife, and give birth totally fine. That's why it was so ridiculous when knee-jerk reaction to the stigma, which arrived in the early 80s, doctors started doing cesarean sections. It really wasn't necessary. It's sad how many women had totally unnecessary C-sections.
Okay, and the
Oh, one
last
other
thing.
thing. No, I just have one other thing on this pregnancy thing, please, Katrina, which is very important. Boys, men who might be watching this. If you are with a lady and you don't think she has caught it yet, it is very important she does not catch it in the last few months of pregnancy. It is suggested, therefore, that you use a condom from month 7 onwards with your pregnant lady, because she really should not catch it. It is where women catch it at the end of pregnancy that you get the disasters, or where mummy has never had it at all and someone with a cold sore comes and kisses new baby. Those are mostly where you get the disaster stories from. Thank you, Katrina.
And lastly, one of the things that I think was sort of slightly amusing are the common myths. And I always like those sort of things. So, we've got things like toilet seats and things like that. Could you just run through some of those?
Absolutely. I'm delighted to tell you that the experts of BASH have checked into this and they make a categorical statement. They tell GPs or younger doctors, etc., reassure patients regarding fomites. Now, I got them to translate that into English. And now it says, reassure patients regarding fomites, bracket, towels, toilet seats, swimming pools, jacuzzis, showers, cups and cutlery when it's facial infection, etc. In other words, the expert doctors categorically say it will not be passed on through any object at all. Towels, dirty underwear, anything you can imagine. Oh, my sex toy that was in the drawer for 2 weeks and then my daughter used it. It will not be passed on anyway except by direct skin-to-skin contact with the affected part when the virus is active with friction. It can't walk, talk, or move by itself. And it does not cause cancer, although others of the 9 human herpes viruses are linked with cancer, but herpes simplex is categorically not. So that's another myth that we like to squash.
Okay. Another one is about blood donation. Can it be
Oh,
passed
of course
on?
you can give blood, because if they didn't take blood from people with genital herpes, why would they take blood from people with facial herpes? As far as your blood is concerned, it doesn't care where you get it. So, of course, you can donate blood. It is advised that you don't give blood when you actually have an outbreak, because that means that you're a bit run down, or you're a bit, tired, stressed, ill health. So, wait till you don't have an outbreak before you give blood. But I've reached over 100 blood donations, Katrina. I'm very proud of myself. So you definitely can give blood. Please do.
Good.
And don't bother to mention it. Listen, you don't need to mention your herpes simplex when you're having a hysterectomy, when you're having a bladder problem, when you're giving blood. No one cares whether you get cold sores or not, facially or genitally. Equally, you don't even have to mention your acyclovir. It's a very specific drug. It doesn't affect people. If you're taking acyclovir, you can give blood, because it's a very superficial medication. It is in your system for 12 hours maximum, and then it's gone. So I've never bothered to mention acyclovir or herpes simplex for any follow-up operations, investigations, or anything.
Okay. Well, I think the moral of all of this is, if you're unsure, is to go and call your support line, which sounds like it's the most friendliest, most helpful, and reassuring chat you'll ever have if you're ever concerned that something doesn't seem right down there.
Absolutely. Please do. Herpes Viruses Association, 0345 123 2305.
I will put it in the link, but thank you for the plug. And Marianne, thank you so much once again for your time. Thank you.
It's been delightful talking to you. Thank you.